Hi, this is Gordon Brown of Therapeutic Movement Seminars, and this is a short trailer we put together to give you a visual representation of our 2-day continuing education course on stabilizing the low back and hips. This is an active, get out of your chair kind of a course, and as such you will be participating and observing movement with an emphasis on being able to recognize and analyze patterns of movement. Patterns of movement refer to how local, regional, and distal muscles and bones coordinate themselves to produce whole body functional movement. Patterns of movement indicate relationships among the different parts, how the arm and the scapula relate, how the hip, knee, and ankle relate, how the neck and the mandible relate, and so on. Our job as the experts on movement in the healthcare field is to be able to see and recognize or identify those myriad common relationships, determine whether those relationships are optimal for that individual, and to design a custom treatment program that optimizes them. This course is designed to do just this. We will do a series of progressive movements that explore and explain the relationships between the hip joints, pelvis, and lumbar spine, and between the low back and the mid back. Our first theme will relate to anterior-posterior control of the pelvis and the coordination of the hip joints with flexion-extension movements in the lumbar spine. This theme will include recognition and maintenance of neutral back, how to stay stable at the lower back and redirect habitual flexion or extension hypermobility stresses to other less sensitive areas like the hips. We will work to mobilize the hips to allow this desired redirection using increasingly more demanding movements to improve hip flexor, hamstring, and hip rotator length, balance, and competence. As part of this first section on movement in a coronal plane, we will also include safe and effective ways to facilitate thoracic extension mobility without lumbar strain or lumbar extension muscle over-involvement. This section relates mostly to sitting, standing, bending, lifting, and carrying with a focus on lumbar stabilization. Our second theme will mirror the first theme organizationally. We will be addressing pelvic rotational movements and its relationship to lumbar rotation with an emphasis on hip internal-external rotation and on hip horizontal add and abduction. In this section, we will lengthen, train, and balance the hip rotators, adductors, and abductors while keeping the low back stable and neutral, then devise ways to mobilize the chest and thoracic spine into rotation while protecting and neutralizing the lower back. This section relates mostly to turning, looking, reaching, pushing, pulling, with an emphasis again on lumbar stabilization. Our last major theme will be three-dimensional hip movements and pelvic diagonals, which will fold the AP and left-right movements we have done so far into something that takes us outside of our usual cardinal planes. This section builds and blends the first two themes, branching out into one-leg flop standing, asymmetrical bending, gait, stairs, and pelvic force couple facilitation. Here is a more advanced multiplanar lumbar stabilization, along with discussion of and application of content to hip issues, fractures, arthroscopic surgeries, total hips, labral breakdown, femoral acetabular impingements, trochanteric pain, and hip muscle strains. There will be labs where you participate to feel the effects in your own body, then watch a few demonstrations to appreciate variety and to recognize patterns. There will also be labs where you partner up with another course participant and use the opportunity to practice teaching techniques and specific manual cueing. Short lectures and demos will explain the difference between static and dynamic integration philosophy or exercise systems. We'll introduce a handy language of integrated movement that we use to describe relationships, and we'll illustrate the importance of pattern specificity in our exercise, meaning that we should be making our exercise look like the motor behavior we're trying to influence. We will discuss teaching techniques or what makes our exercise more informational, and will codify and illustrate the 4 principles of optimal movement. So come, move around, have fun, learn lots.